everyone, and welcome to another edition of Overcoming Depression and Anxiety, brought to you by Healthy Me Summits. I'm Joanna Rushton, your host, and we're being joined today here by Dr. Gil Kajiki. Dr. Kajiki is the founder of the Valley Thyroid Institute. He graduated from the Pasadena College of Chiropractic and has been a chiropractor for 30 years. The main focus of his practice is thyroid issues. Through working with his patients, he's developed the Kajiki protocol for determining thyroid and autoimmune issues, with a particular concentration on Hashimoto's. He offers his patients answers and protocols to improve thyroid function, but also overall health. Dr. Kajiki, thank you so much for joining us. It's an absolute pleasure to be here and speaking with you today.
Thank you very much, Joanna. Nice to be here.
Look, I think first of all, what our audience would love to do is connect with you and understand a little bit about your own journey and what's brought you here to specialize in thyroid function in particular as a chiropractor.
Okay, great. Well, I've been a chiropractor for about 32 years right now. And most people think of chiropractors as neck and back doctors. And that's truly what I was for about 20 years. I was strictly structural chiropractor, worked on spinal alignment and spinal structural problems. But then about maybe 10 years ago or so, my wife, Kim, started getting ill. She was a high profile corporate employee, did HR for a very large Fortune 500 company. So she was traveling all around the world and doing different things, raising, to our teenage daughters. But she got sick one day at a convention in New Jersey. But, like everyone else, she came back with a cold. The cold kind of lingered, but it kept on lingering, turned into Epstein-Barr. And then the Epstein-Barr wouldn't quite go away, and it kept on lingering, and that turned into pneumonia. And she had off and on pneumonia for a couple months. But then it started getting into heart palpitations, insomnia, hair loss, depression, digestive issues. And then it started to get really bad. And then probably one year, about a year later, she was in the hospital. And I took her there in the middle of the night because she couldn't breathe, thinking, well, they'll just give her oxygen, have her there for a few hours and let her go. Well, it turns out she stayed there for 3 days, just before Christmas, which is an awful time to be there. And I had started studying functional medicine just prior to that. And so the day before Christmas, I came in and I said to her, look, I figured out what's wrong. I got what's going on here. And the doctor happened to be there. And I showed the blood tests that I had done on her just before she went in the hospital. And turns out she had Hashimoto's thyroiditis, where it's an autoimmune condition that's attacking her thyroid. And the doctor concurred. He agreed. I said, great, we got to figure it out. What do we do now? And his answer was thyroid medication. How long? Forever. I said, I don't understand. This is an immune system problem attacking the thyroid. Why would we give her thyroid medication? Because that's the protocol that we do. And she fired her doctor, and I took her home. And with the help of other colleagues and other people who are smarter than me, we got her Hashimoto's completely resolved, totally in remission. She's had virtually no symptoms at all for the last 7 years, never been on thyroid medication. And that was my journey into realizing how many women had these thyroid problems and how many women are going through lab tests that the doctors say are normal, but they still feel lousy, and thyroid medication that doesn't work. So we decided to dive into the thyroid world and start offering our help to these women who are, kind of out and down because their doctors either don't believe them or they have medication that doesn't work, and they're running out of answers. They're running out of places to go. And that's how we got into this.
And, it sounds, again, a very typical scenario, which is unfortunate about a lot of the Western medicine approaches, is that we end up treating the symptom, rather than really addressing the cause. And as you said straight away, this is an autoimmune problem that's affecting the thyroid. But what we fall into the habit of is actually treating the symptoms of the thyroid rather than addressing what's creating it and kind of following the breadcrumb path back far enough for us to get to the root cause. And I think that's a really important message to give to our audience and people that are used to managing symptoms, but don't really know how to navigate or roadmap towards what really is the cause.
Right. And even your theme of your summit, which is depression, you know, traditional medicine does not go after the cause of depression. They go after the symptoms. And I can tell you, it's never a shortage of depressive medication in your body is the reason why you have it.
Absolutely, absolutely.
Go over the mechanisms on why you have the depression as well.
You know, I say the same with clients when, you know, when they complain of a headache and, you know, I ask them if they've drunk any water because I can guarantee it's not an aspirin deficiency. You know, same sort of analogy. You know, but, you know, what's really interesting here is we're going to be talking a lot about the thyroid. And I think, you know, number one, I know a lot of personal clients that I've worked with that we've, you know, actually established that there's either an autoimmune issue going on or a genuine thyroid hypo condition going on that has been at the root cause of a lot of their either depression or anxiety, which are quite different symptoms and quite different experiences.
Right.
And I think, again, to our audience, anyone out there who might be experiencing depression or anxiety, you know, this topic of really looking at the thyroid connection into how it can be contributing to their experiences is a really important and interesting area to consider in your overall health, because, you know, how many people or how many times does one sort of go towards looking, first of all, at some sort of cognitive therapy or psychology, psychiatry, or exercise or nutrition. And for years, you know, just, you know, as your wife did for a number of months, you know, kind of go around in circles until we actually find the real cause. So today's really looking at thyroid and the thyroid function in relationship to depression and anxiety. And I know it's a big question. My first question is a you know, a simple one, but I have no doubt it has a very complex answer to them. But, you know, I guess if we can sort of give our audience a little bit of an understanding as to how does the thyroid and the function of the thyroid relate back into experiences of depression and anxiety.
Okay. So let's start with by saying that there's not ever one mechanism. There's never one mechanism. There's always multiple mechanisms for every single person. I mean, you may have done multiple mechanisms or multiple therapies, and that one last one is what fixed it, but it wasn't because you did that one, it's because you did the other three first and then did that last one. So there's multiple mechanisms. So, you know, as a listener and saying, yeah, I've got this depression, what is it? What could it be? Please don't try to look for one mechanism, right? It's multiple mechanisms. And I'm going to go over what the most common ones are regarding the thyroid. And then that's, you know, like one section of that's just the thyroid involvement of the depression and anxiety. It could be either, you know, hormonal, and it could be neurological, it could be metabolic. There's all kinds of other mechanisms, but we'll go over the thyroid and its relationship with that. So one of the main one is Hashimoto's. Okay, Hashimoto's is an autoimmune attack of the immune system on the thyroid. And what ends up happening is when that immune system attacks the thyroid, it releases thyroid hormone and thyroid tissue into the bloodstream. And by the way, your immune system destroys your thyroid and it does not grow back. So it continually, it's like a flesh-eating bacteria. It destroys that thyroid tissue and releases that thyroid hormone into the bloodstream. When that happens, you will typically get hyperthyroid symptoms like anxiety and racing heart and heart palpitations. The heart palpitations in itself will give you anxiety. And then what happens is the autoimmune attack subsides, then the TSH then starts to rise again, and you go into a hypothyroid mode. And that typically, because you don't have enough thyroid hormone circulating in your system, you will tend to get depression, constipation, dry skin, dry nails, right? And just a very slow metabolism. So it's like with my wife's case, she had the anxiety at night and she had the depression during the day very often. So with hers, it was an autoimmune mechanism. And just by working on the autoimmune, we got her anxiety, depression under control.
So what I'm hearing there, first of all, is that anxiety tends to come with the hyperthyroidism, and then
Right.
on the way back down into more of the depressive experiences or symptoms, that goes with the hypothyroidism.
Right.
And that can actually be fluctuated within a 24-hour period, is what I'm hearing.
Yes, it could happen within a day, within 2 weeks, within 3 days. And so if you find that your symptoms are kind of roller coaster like hypothyroid, hyperthyroid, hypothyroid, you should really suspect Hashimoto's may be one of the reasons why. Okay. Another very common is gastrointestinal dysfunction or GI dysfunction. Millions and millions of my thyroid patients, probably virtually all of them, have GI dysfunction. And it's one of the main dysfunctions that people suffer from all across the board. Well, your GI tract makes 90% of the serotonin that your brain uses. Serotonin is one of the main neurotransmitters. And if your gut function isn't producing this serotonin, then this serotonin is not going to make it up to the brain, and you're going to have this neurotransmitter or serotonin deficiency. Well, serotonin is your feel-good neurotransmitter. It makes you feel like you have hope and you're alive and you want to do things, you have motivation, and that will often cause depressive type symptoms with the lack of serotonin in your body.
You know, what I'm hearing here is such a common theme with so many of our experts, constantly bringing us back to the importance of the gut-brain relationship and this whole gut-brain axis via the vagus nerve. But the health of our gut really seems to be at the forefront of how we can regulate our, mental wellness and our mood regulation.
Yes, it's critical, and to the point where I teach my patients, if you have any kind of GI dysfunction, burping, gas, acid reflux, bloating after meals, abnormal bowel movements, you don't have a bowel movement every day, your stools don't float, or stools don't sink, they float, they're light brown in color, any kind of GI symptom, that means you're creating inflammation in your gut. And so you're creating either a dysbiosis or an environment for infections or low neurotransmitter production. If your gut is on fire, your brain is on fire. If your brain is on fire, it controls your entire body function.
And it's reminding our viewers that, over 60, 70, 80% of our immune system lives in our gut.
Is in your gut. So if you have a Hashimoto's condition and you have a GI problem, you're never going to get your immune system under control if you don't get your gut under control.
Yeah, really big message to share with our audience there. What about low dopamine?
Low dopamine, yeah. Well, as you know, dopamine is a precursor, if you don't have enough of it, for Parkinson's, which is, once again, a neurological condition, right, affecting the brain. So your low thyroid function will cause a release of dopamine in the midbrain, right, making it difficult to maintain thyroid function. So that low thyroid function, which is caused by who knows different mechanisms, one of them is GI function, right? You don't have enough T3, T4 conversion, causes low thyroid function, right, causes that dopamine release. And so now you've got this neurological, metabolic, neurotransmitter pathway that's altered, and you're thinking all you know is you have depression, yet it's a thyroid neurotransmitter issue. And so all the depressive medication in the world is not going to work.
So, one thing that I know that I talk a lot to my clients about when it comes to the serotonin and the dopamine is the importance of stabilizing our blood sugars. Is that, part of maintaining that balance? Because, excess stimulants is like coffee, caffeine, exercising at the wrong times of the day, create this stress response in the body. Is that's relevant too?
I got to tell you, probably the number one thing that I tell people that they have to watch for the rest of their lives is their blood sugar stability. is even when you're feeling great, you've got to watch your blood sugar stability. You should not eat just because you're hungry. You should eat by the clock, and your body needs stable blood sugar. It doesn't want the dips of hypoglycemia, and it doesn't want the spikes of the insulin surges. It wants that very stable blood sugar. And that stable blood sugar controls so many different functions in your body. I mean, just in itself, if you have hypoglycemia, I mean, your brain uses 30% of the glucose that you intake every day. So how well does your brain work if your entire body is deficient in glucose?
Exactly, exactly. And isn't the window or the amount of sugar that's actually required to stabilize our blood sugars incredibly small, like half a teaspoon or something?
It's very, very small, yeah. And so you don't need to eat big meals. You just need to eat small, high-quality protein snacks throughout the day. And you keep your blood sugar stable.
Yeah, you know, and the large amounts of sugar that most people take in with, you know, the common, you know, Australian diet, American diet, or you know, really what we could call the Western diet, is often laden with massive amounts of sugar, which is, as you say, constantly challenging our ability to stabilize our blood sugar levels.
Yeah, and you know, something we should really clear up is when we talk about sugar, we're not talking about necessarily table sugar, white sugar. We're talking about carbohydrates, right?
That's it.
Processed foods, potatoes, rice, corn, beans, lentils, right? Those things. We're talking about the carbohydrates that turn into sugar, really, that are more of the culprit than the actual white sugar itself.
Yeah, yeah, absolutely. So we've spoken about, you know, digestion and gut issues as a massive contributing factor or a precursor towards having thyroid dysfunctions. What other sort of lifestyle factors can cause a thyroid dysfunction?
Well, one of the most common ones is poor sleep hygiene. And when I say sleep hygiene, meaning that you either stay up too late, right, or you sleep too long, but whatever you're doing, you're throwing off your circadian rhythm, which will then throw off your cortisol levels, which will throw off your adrenal patterns, which will throw off your thyroid patterns. And so, I mean, a lot of people say, I had a patient yesterday that said, oh, I looked at their cortisol pattern, and I said, look, your cortisol's rising at night. Oh, I'm a night owl, that's why. No, that's not why. Not because you're a night owl. You're a night owl because your cortisol is rising, not the opposite way. And what's happening is that's causing some excessive adrenal stress on you. And that adrenal stress will in turn cause thyroid dysfunction. So get to bed at a reasonable time. Get the proper amount of rest. Everyone needs different amounts of sleep, I agree. You may not need 8 hours or 6 hours, but get to sleep at a reasonable amount of time. One of the biggest problems with thyroid patients is insomnia. They either have trouble going to sleep or staying asleep. And instead of trying to resolve that, what they do is they just say, well, I can't sleep, so I'm just going to stay up anyways. And they go to sleep at 2 o'clock, 3 o'clock in the morning. Well, you should just cut the electronics, right? Don't drink any water before bed. Don't give your body any reason that it needs to get up in the middle of the night. So have that good sleep hygiene before you go to sleep. So at least you're not firing up your brain at night with electronics or games or stories or books you're reading that are firing up your brain. Do something calming, right? Even just get into bed and close your eyes. That's the first step towards getting to sleep if you have insomnia.
So one of the things that I'm also hearing there is the relevant relationship between the adrenal glands as being a precursor to affecting the thyroid gland. So, you know, what I'm thinking of right there is how many people are you know, suffering from chronic stress or prolonged periods of stress where, you know, they're working too hard. It's a constant output without taking the time to you know, allow that anabolic or restorative rejuvenation of the body, and that's therefore driving the adrenals to becoming literally whiplashed, you know, to the point where now that's affecting the thyroid. Is that kind of the cascading effect that happens in the body?
Absolutely. And along with that is your blood sugar, is your cortisol surges will cause blood sugar drops and vice versa. So it's this, you know, multi-mechanism, situation. And I hate to use stress as an excuse for what's going on, because the thing is, we all deal with stress. We are not going to get away from it. The key, though, is how do you manage it? How do you squelch it? How do you diverse it? I mean, that's the key. So don't try to stop the stress in your life, but try to find a good way to manage it. And, one of the things I tell people is, well, number one is eat really frequently. Keep your blood sugar stable, because if you keep your blood sugar stable, you won't have the cortisol surges quite as much, right? So that helps your adrenal glands recover more. Another thing is schedule me time, right? Everyone complains they don't have any time. You have the same 24 hours as I do, right? The most important person in the picture right now is you. So schedule time out for yourself, whether it's 30 minutes or 15 or 2 hours, whatever it is. I tell people you need to schedule me time. Whereas for this 30-minute period or 2 hours or whatever it is, you do whatever you want to do. You do not do what you have to do. Do not do what you should do. Do not use it as a makeup time to do errands and chores. If you want to do nothing, do nothing. Or if you want to walk, or if you want to read a book, or you want to be with a girlfriend, or whatever it is, just schedule it in so that you don't ever have to say, I don't have time for myself. That will help you decompress.
I think that's a really important message to reiterate. I'm always speaking to my clients about this misconception that time is the most important commodity, when really energy is our most valuable commodity. We all, as you say, have the same hours in a day, but it's really how much energy we have in order to make use of those hours. And,
right.
I think that what we're explaining to our audience is that, we're all literally this biological battery that has the capacity to literally recharge itself when we make the right choices around food, around sleep, around our thoughts, all these lifestyle factors that when we choose the right ones, we support this biological battery to literally self-sustain itself. And when we don't, we end up paying for our energy through caffeine and stimulants and sugary foods, and we're actually then having to pay for energy, which we could really make for ourselves.
Right. You're right. I never thought about it that way, but you're absolutely right. You're paying for it by getting these external, stimulators.
And so, what I would love to just look at here when we're talking about, you mentioned before about not skipping meals and the importance of that kind of scheduling, and that routine helps to regulate blood sugar levels. I just want to also come back and, ask if you could elaborate a little bit more on the dangers of that high carbohydrate diet that you mentioned before. And how that is, going to impact first and foremostly into the blood sugar levels, but then back into the thyroid in particular.
Okay, yeah, sure. I don't know about Australia, but in the United States, diabetes is rampant. I mean, it's an awful condition. It is going to probably bankrupt our healthcare system if it doesn't bankrupt before that. But it is awful. We have so many processed foods, so many high carbohydrate foods here that people use those convenience foods as their meals now, not their snacks. And so if you're going towards a high carb food like popcorn or rice snacks or potato chips or pretzels, or you're having these high caffeine drinks to stimulate your body for this energy, it's a dangerous situation, because what's happening is you're creating these insulin surges, because you're flooding your body with these high carbohydrate foods and blood sugar, and you're creating these insulin surges. Now, these insulin surges can only work on the cell so many times before that cell goes, you know what, you've been banging on my door for so many times, for so many years, I'm just not going to respond anymore. And that cell doesn't quite open up like it's supposed to. That's called insulin resistance. So now you've got this flooding of insulin in your body. Well, that insulin is very inflammatory. And that inflammation particularly is dangerous to tissue, starts causing tissue damage. But it's now been called diabetes 3 of Alzheimer's. So,
Wow.
so much blood sugar and insulin is getting into the brain now. It's destroying brain tissue, and that's called diabetes 3 now, this Alzheimer's.
So what I'm hearing is that if you have diabetes, then you're increasing your risk of having Alzheimer's. Is this a
Dramatically.
direct correlation? Okay.
Dramatically so. Yes. Yeah. So it's these, diabetes is not a blood sugar disease, it's an insulin disease.
Yeah.
And so it's going to burn out your pancreas to the point to where it can't make this insulin anymore like it needs to. And now you're going to have this constantly high blood sugar because you've beat on these doors for so long with insulin that the cells no longer respond and the pancreas can't push out that insulin anymore. So it's causing this inflammation in your body, inflammation in your brain, inflammation in your tissues, causing tissue destruction. I mean, that's all because you're snacking on these high carb foods very often.
So we're talking about lifestyle choices right now that can impact thyroid dysfunction or create a thyroid dysfunction. We've spoken about sleep, we've spoken about diet, we've spoken about not enough me time, and learning to have some stress strategies to actually manage that stress response and the hormonal response. What about exercise? Do you find that people is there a relationship to over-exercising or under-exercising with the hyper or the hypo? Or am I being too obvious?
I don't think you're being obvious. I mean, if you have a thyroid issue and depressive issues, the likelihood is you're probably not exercising. You probably don't feel like you have the energy or the motivation to exercise. And so that in itself is going to be a problem. Most of my thyroid patients, they want to exercise, they can't. They just don't feel like they have the energy or the motivation to do it. And so if that's where you are, yes, you should exercise. But exercise, as important as it is, you really need to go to your tolerance. I mean, walking for 10 minutes is certainly better than not doing anything at all. And do things to your tolerance and work your way up slowly, but do something. I mean, movement is life. Right. And so, yeah, you don't have the energy, you don't have the motivation, but don't sit there. Right. I mean, do exercise. And unfortunately, I tell people that if you walk around all day long at your jobs, that's not considered exercise. Right. That's considered a recreation. Your body doesn't view that as exercise. Exercise is the continual increasing the amount of the cardiovascular load that it takes on. So you need to walk at a faster pace or walk longer. Right. But yeah, do something as far as exercise, because I don't even need to tell you the benefits of exercise with depression. I mean, it's probably the quickest fix for depression that there is.
Yeah, absolutely. And probably one of the most more commonly known solutions or recommendations that lots of practitioners give is obviously getting out there, getting some sun, fresh air, and all the things that come with, the right environment to exercise in. I'm curious about hyperthyroidism in relationship to exercise. Do people find that they can exercise more easily when they have hyperthyroidism versus hypo, or there's no correlation there?
Well, I mean, I think if you have, you have to determine, first of all, do you have a true hyperthyroid? Or do you have the Hashimoto's that's periodically hyper, periodically hypo? But if you have the true hyperthyroid, which is a Graves' condition, or it's an anterior pituitary suppression of the TSH, then I don't think it's necessarily easier. I mean, your metabolism is going faster, but I don't think that makes it easier for you. But if anything, I found that many of my Graves' patients who have hyperthyroid, autoimmune hyperthyroid, they actually are more fatigued than anything else. Yeah. So I don't think it makes it easier for them at all to exercise anymore. I think it's just, once again, it's to your tolerance, and some is better than none, and do what you can.
Yeah. Okay. So I'm really curious around whether or not thyroid deficiencies are more prevalent within males or females. Is there any distinction there?
Well, statistically speaking, it's probably 10 to 1 females to males of thyroid deficiency.
Wow.
Yeah, I very seldomly get male thyroid patients, very seldomly.
And do you have a theory on that as to why females are more susceptible?
I don't really. I mean, there's all kinds of I don't know, theories, but I think none are proven. And I just say, well, look, it's a known statistic, and it's unfortunate that you're a female and you get this. Sorry, let's work on it now.
And I guess you probably do see quite a common theme and pattern in the lifestyle factors that we've spoken about with everybody who comes in with a thyroid problem. Would that be true?
Yes, yes. And I have international patients. So whether it's Australia or New Zealand or Canada or Germany or Romania or, the United States, it's, same problem, different color.
Yeah, for sure, for sure. So I'd love to get a little clearer in my own mind if there are any specific differences between Hashimoto's thyroiditis versus a hypothyroid or a hyperthyroid. Are they all an autoimmune condition at the end of the day?
No. However, 70 to 90% of all the people who have hypo slow thyroid or high TSH, 70 to 90% of those people are autoimmune Hashimoto's. That's a gigantic percentage.
Yeah, wow.
It's a huge percentage that if you're watching this and you have high TSH, which in my book is above 3.0, if you have higher than 3.0 TSH, there's a 70 to 90% chance that you have autoimmune Hashimoto's, which means you have more of an immune system problem than you do a thyroid problem. Okay? If you're hyperthyroid, hyperthyroid can be Hashimoto's, it can be anterior pituitary suppression, or it can be Graves' disease. And I'll tell you, more people get misdiagnosed by that Graves' disease, low TSH than anything else. I mean, many times I'll get patients saying, I've been diagnosed with Graves' disease. Like, really? But you're sluggish, you're slow, you're overweight, you have constipation. That's not a Graves' patient. Right? Graves' patients is thin and, hyperactive and heart palpitations and anxiety. That's not you. And what we found out is that the doctors did one TSH test. They found it was low, and they said, okay, you've got Graves. So very, very often misdiagnosed, and Hashimoto's is very often missed if you have hypothyroid because it's an autoimmune condition. And the only way you're going to find it is if you do the antibodies tests. And unfortunately, 15% of the population is going to test false negative.
Oh, wow. Okay.
Yeah, just kind of statistically, people will test false negative. So even though someone does the Hashimoto's antibodies, 15% of the time will come out false negative. Well, now you as the practitioner have to have the clinical skills to determine, is this false negative or is it really non-Hashimoto's and just hypothyroid instead?
So really being across the type of symptoms that are displayed for the various different types of conditions is really, really important when you can't rely on a blood test or you can't rely on testing diagnostics alone.
Yes, exactly. You got to take a good history on them. Ask them, when does this start? How long has it been this way? What do you feel? What do you feel when you feel good? What do you feel when you feel bad? What are good days? What are bad days? You have to really get that information. And, I'm finding that as a practitioner, you can't do that when people fill out your history form in your waiting room and then you see them by just glancing at 3 pages. So we have an 11-page intake form. We make sure that they get it into us 2 days before I talk to them, so I have time to review their labs, review their history form, and I pretty much know what's going on with them before they even walk in the door.
Yeah, I think that's it's a really important point there for people that are looking for a good practitioner and what the practices are of a good practitioner. And if they're presented with some history forms right there and then just before the appointment, then that's a pretty good indication that there's not going to be the time, the effort, and the the real considerations that need to be put into a client's case study and case history.
Right. And natural practitioners like you and I, we don't get called first.
Yeah.
We get called last, right? After they've already been through 5 or 6 or 10 other doctors, then they start looking for people like us. So we've got to shine, right? We've got to put more time, more energy, more effort into this case than everyone else did.
Yeah, absolutely. So, that brings me on to just a few questions around testing for thyroid dysfunctions. Are there more comprehensive thyroid tests that aren't necessarily commonly known that our audience may do better to become aware of those and actually ask for those if they've gone down the road of, ruling out thyroid in the past, but they still feel that that might be an issue, but we haven't got to the real issue because of types of testing?
Right. First of all, let me open up with this. If the doctors have told you your lab tests are normal, but you still feel lousy, I'm going to tell you this. There's no way that could happen. Okay? I'm getting you all off the hook. There's no way your lab test can be normal and you still have symptoms. There's just no way. So what's happening is the doctor is either doing the wrong tests, not doing enough testing, or they're reading them wrong. There's never, ever been a patient under my care that's had all normal lab tests and, everything was perfect with them. Right? So if your lab tests are normal, you still feel lousy, there's still a problem. That's what you have to realize first. Okay. Now, there are 12 possible thyroid tests that can be done typically. Okay. Typically, traditional medicine only does 2 to 3. Traditional medicine will typically do TSH, free T4, and maybe if you beg them, you'll get a free T3. Why is that? It's because they only need TSH and free T4 to dispense medication. Right? And what are your choices if you go to traditional medicine? Your choices are medication, radiation, and surgery. That's it. So they only need to do free T4 and TSH to dispense medication. Now, if that works for you, great. You don't ever contact people like Joanna and I. But if it doesn't work, now you're looking on the internet. Now you're looking for other doctors to help you. So you need to get more comprehensive testing. In my office, I do a full thyroid panel on everyone. They get TSH, free T4, free T3, total T4, total T3, reverse T3, T3 uptake, TPO antibodies, antithyroid globulin antibodies. And if I suspect Graves', then I do a thyroid stimulating immunoglobulin. But everyone gets the full panel. That's the only way you will know what type or if you have a thyroid dysfunction.
Yeah, really, a really important message there for people. I've had a lot of clients myself that, have come, they said, no, my thyroid's fine, I've had it tested. And, the question is, well, what tests? And as you quite rightly say, invariably it's just the first, 2 or 3. And when you go searching for a little bit more information, a little bit more diagnostics, then, we reveal that there's further complications there that aren't first found.
Right.
Which leads me to a question around medication. We've spoken a lot about the various lifestyle factors that can impact our thyroid. So, the key question here is, does medication alone sort the problem out? Surely not.
Unfortunately, there's only one thyroid pattern that medication alone will help, and it's called primary hypothyroid. There are 6 main thyroid patterns, but only one of them respond positively to medication only as a sole treatment, which means your thyroid medication only has a 17% chance of working for you. Wow. And an 83% chance of not working for you.
So the 83% is lifestyle.
Well, it's lifestyle, and there's other mechanisms that feel like thyroid, but it's not thyroid, right? I mean, an example, a T4, T3 under conversion, that has nothing to do with the TSH. You're making enough TSH, you're making enough T4, but it's not being converted properly into T3, which is the active thyroid hormone. So you have thyroid-like symptoms, but your TSH is normal. Now what? Well, no one did the T4 and T3, so they don't know that you make enough T4 and that your body isn't converting it into T3, which is the active stuff. And so you're getting these thyroid symptoms. Well, that conversion mostly occurs in the liver and in the gut. There you go, back to the gut again. How many people have gut problems? Yeah. So if you've got a gut problem, you're likely having T4, T3 under conversion. You're not getting the thyroid hormone inactive one turned into an active one, so you're getting thyroid symptoms even though your TSH is normal.
This is really great information, for our viewers to really understand the relationship between thyroid and the function of the thyroid. and the various tests that they really need to focus on getting. Because if they're really going to get a strategy around actually overcoming their depression or their anxiety, depending on how it manifests, if it is a thyroid contributing factor, this information is absolutely gold. It's what people need to know. Now, you went back for a second and hit again on the gut, which leads me to questioning also something that I see a great deal with my clients, and that is food sensitivities. And I've even myself personally, I've had lots of experiences with food intolerances and how that's played back into disrupting my mood, often giving me either anxiety symptoms or depressive symptoms. And when I've done the food rotation and I've done the whole food diary, and I've kind of been disciplined about pulling certain foods out for a period of time and then reintroducing them, I've really made the link and the connection between how significant food intolerances and sensitivities can be to affecting our moods. Can you talk a little bit about that for our audience?
Gosh, I tell you, food is probably, of everything, it's the most important protocol that you need to watch for the rest of your life. It's the one thing that you are influencing your body multiple times per day. And food can be a slow medicine or a slow poison. And if you don't pick it right, it can be a slow poison. Now, I think with food, people need to start with common sense. Okay, so many people, I don't know what to eat. I don't know what to eat. Well, let's start here. Okay, since I want to give your listeners tools on what they could do, here's the first lesson with food. If you get a negative symptom after you eat a certain kind of food, regardless of how good it tastes, stop it. Stop it. If you know dairy bloats you, stop it. If you know bread causes you to have anxiety or mood swings or brain fog, stop it. If you know that potatoes cause you to have loose stools, stop it. I mean, really, start there. Start with the common sense stuff. Stop. If you're getting negative symptoms and you know it, stop it. Now, other than that, people said, I've tried, like you, I've tried the food rotation diet, I've tried AIP, I've tried the SIBO diet, I've tried all these things. Well, now you need someone to help you with this. Now, I can tell you that for many, many years, I did paleo diet for many, many people. And then I went to paleo autoimmune for many, many people. Well, now I'm finding that paleo autoimmune can flare up some people because not everyone is the same. Now, I can tell you that if you're not going to do a food sensitivity test, and there's a test by Cyrex Labs here in Phoenix, Arizona, in the United States, they do the only food immune system response testing. They test 180 cooked and raw foods, and it's an immune system response test. It is not a food allergy test. They're the only lab that does cooked and raw both. Okay? So it could create a customized eating protocol for you of exactly what you can and exactly what you cannot eat. Now, if you're unable to do that test, but everyone could do it, I even do it internationally, okay? The next best thing is to do paleo autoimmune, which is you're taking out all the possible inflammatory foods. No gluten, no soy, no yeast, no dairy, no eggs, no corn, no rice, no beans, no nightshades, no potatoes, right? Things like that. Start with that next. But food causes inflammation, okay? And food, if it's a poison in your body, your gut is going to try to attack it. And the way it attacks it is with fire, inflammation. And that inflammation will now cause intestinal permeability, leaky gut. It'll cause a dysbiosis of the good and bad probiotics. It'll cause disruption of your hydrochloric acid production. It'll cause disruption of your digestive enzymes. And now we have a whole host of other brain gut-related problems, serotonin deficiencies, neurotransmitter deficiencies. I mean, we have a whole host of problems just because of foods.
Yeah, absolutely. And I think, something there that I've certainly, dealt a lot with in my practice, and more so as I become more present and conscious to the emotional relationship to food as well that people have. And, it's really about, what I've found, especially working with my clients, it's really about meeting them where they're at. Because, especially if somebody has been searching for a solution for a long time and they feel like they've done so many different things to their diets, it almost becomes, a lot of people can actually create anxiety over the fear of, can I eat this? Can't I eat this? Should I eat this? Shouldn't I eat this? And they actually create stress and anxiety just by the process of elimination, or by the process of trying to determine what is right for them or wrong for them. We can create more of a problem. And so I'm very wary with clients to really, first of all, try to calm the relationship with food,
Right.
and do it at a pace in which they're ready for. Because you mentioned before, it's common sense to come off foods that we're having a negative response to. But step number one there, people need to be conscious enough to realize that the bloatedness is down to what they've just eaten, which,
Right.
lots of people aren't necessarily connected to that, to their body and the body's feedback. I think I teach a lot about, becoming present in the body and learning what that biological feedback is, and how the body talks to us. And so sometimes I think there's a bridging of that relationship first, so people can put two and two together with what they're eating and what they're experiencing. And then, the other side of it is, you mentioned before, just come off it. If you know that that's a negative response, just come off it. But, some people are challenged by the fact that they're addicted to
Yeah.
a lot of these foods, the grains, the gluten, the opiate type receptors that are in these foods that actually create an addictive mechanism. How do you speak to your clients around that issue?
Yeah, you're right about that. I certainly take a little more of the direct assertive approach. With my patients, it's like, look, you got to stop it at some point in time, right? Whatever you have to do. But you're right. If it's an addiction, then you have to, like you said, recognize it first. Recognize that you are either eating it emotionally, or you're eating it because you have a physiological addiction to that grain, or bread, or whatever it is. So that's a tough thing, but you got to start somewhere, right? And maybe it's by, like, look, stop it once a week, right? And then stop it twice a week, and then stop it 3 times a week. And then if you fall off the wagon, what I tell people is, look, just because you blew it on Saturday morning, don't say, forget it, I'll start on Monday. Start where you are. Start from, you can always start over the next meal.
Yeah, it's a really good point. It's a really good point. And that, that takes the pressure off. Because, when we fall off the wagon, we often give ourselves, a lot of guilt and shame around, oh, I failed and I didn't, I can't even do this, and we can start really, beating ourselves up. And that's not helping the situation. So, as you say, we have to start somewhere, and just talking kindly to ourselves and reminding ourselves that, yes, we can start again at the next meal,
Mhm.
is a really important message for people, so that they don't give up. The information that you've been sharing, Dr. Gill, has just been really, really amazing, and have no doubt that we've been able to join some dots together for people to
Right.
understand what their relationship to thyroid and their mental health and wellness is, and giving them some solutions, certainly giving them education and awareness around further testing that's out there, and the lifestyle factors that contribute back into thyroid. Reiterating the message around, without a healthy gut, well, there's no health anywhere in the body.
Yeah.
And, I just want to thank you so much for putting all of these pieces of the puzzle together so that our audience can better navigate their own health, because it's about empowering our audience, and letting them feel like, A, they need to be accountable, but B, they've got the power to be, and that their health doesn't always have to feel like it's in the hands of someone else.
Right.
I think that's a really important point.
Yeah. And there are a lot of practitioners like you and I out there. I mean, I know with some of you out there, you've been saying, I've been to the 12 doctors already. There's no one out there. There's always somebody out there. So don't give up that search for that Joanna or Dr. Kajiki.
Yeah, absolutely, absolutely. So we've got time for just one last question. Okay. It's been asked to all of our speakers, and it's just a way of pulling everything together and also sharing with our audience the importance of the power of what we talk to ourselves and how we talk to ourselves. And neuroscience has kind of proven that we are what we think, and what we tell ourselves and what our brain believes. Biochemistry kind of gives us an experience of that. So we've asked all of our speakers to share with us what their I am statement is. If we believe that the power in the I am and how we speak to us is so important to our physiology and our biology, then, have you ever used an I am statement for yourself to, to build reassurance or self-confidence, or, to help yourself through a challenging time?
Sure. And I may not use the proper adjective here, but for whenever I come across something that I'm a little nervous about, or I mean, even this interview I prepared for days in advance for, but I talk to myself and I say, look, I am capable of overcoming this.
Yeah.
And whether that be a health challenge or an interview or a difficult patient that I have to work with, or, a financial issue, I am capable of overcoming this. And even if it's not true on the outside, I'll just lie to myself long enough till I believe it.
I love that. You made a really important point there of using the words that feel that you can resonate to at the time. Even if you can't say, I am well, you can say, I have the potential to be. Because that is the truth. Even if you're not right now in this moment, you have the potential to be. So thank you so much for sharing your knowledge, your expertise. It's been absolutely amazing, a wonderful, wonderful conversation. I know it's going to benefit so many people. Thank you again so much for your time, Dr. Gil.
Great. Thank you so much, Joanna.
You're welcome. See you soon.
All right. Bye-bye.